Welcome back. How many people have or had the coronavirus? It's been nearly 3 months since the pandemic hit the US, and we still don't really know. Well, now a major antibody study is underway, all in an attempt to answer that very question. With us now is Dr. Michael Busch, who is overseeing the study as director of the Vitalant Research Institute. Vitalant is the country's largest nonprofit blood collector. Dr. Busch, welcome to the show. I'm going to dive right in here because we have so many questions. First, tell us about your study. What exactly are you and your partners and colleagues in the CDC hoping to accomplish?
Yeah, thank you. Yeah, first I'll make a correction. It's the Vitalant Research Institute, and my company, Vitalant, is the second largest. The American Red Cross is the largest blood collection organization, but they're very involved in this study. The American Red Cross, the New York Blood Center, blood centers throughout the United States, and the testing laboratories are collaborating with the CDC to measure the frequency that the antibodies are detectable in blood donors across the country. So this study will involve collection of 1,000 representative samples per month from each of 25 metropolitan regions in the US, and then rapidly testing those samples with very sensitive and accurate antibody tests to determine the proportion of the donor population that's infected, and then extrapolate that to the general population.
First, thank you for correcting me. That is a very important distinction, Doctor. All right, let's talk a little bit more about the study. How is it going to work? From what I understand, you're tracking 1,000 donors in about 25 metro areas every month for a year. Is that correct?
Yeah, actually, the study started several months ago in what we'd term a vanguard phase, funded by NIH, part of a separate program called the REDS Response Program. So we actually started in 6 cities, and then the study is expanding in June and July to a total of 25 metropolitan regions. And you're correct, we will collect 1,000 representative. These are samples that are already collected from healthy blood donors, and we'll tap into those samples after the routine testing of blood donations is done in the testing labs. We'll capture those plasma samples and test them for the antibodies. And unlike the test that you just showed, which is a rapid test, a point of care test, we'll be using very sensitive and specific laboratory-based antibody tests.
I know this is probably obvious to you and your colleagues, Doctor, but let's take a step back for our viewers. Why is antibody testing on this massive scale so important? Could it help determine when and who goes back to work?
Yeah, well, so the tests that were first available were swab-based assays that were performing molecular test, PCR technology, to detect the virus itself in an oropharyngeal swab type samples. That can only detect the infection for the first few weeks when a person is sick, or potentially even after asymptomatic infection and shedding. In contrast, the antibodies become detectable within about 2 weeks of infection, within about a week of symptom onset. And those antibodies persist over time. And they're able to therefore tell us what proportion of the people in a sample have been infected in the past. We can't tell exactly when they were infected based on the antibody testing patterns, but we can detect anyone who's been infected in the last, certainly many months and probably years. Those antibodies, though, are not necessarily indicative of protection from reinfection. So there are many studies, both part of the studies we're doing and many other groups are trying to understand the patterns of antibodies, their ability to neutralize the virus and to protect people from becoming infected again if exposed. If this is anything like common cold viruses and many other respiratory viruses, people may be susceptible to reinfection after 1 or 2 years and may require vaccination to boost immunity. And certainly we need to understand the relationship between the antibody persistence over time and that issue of protection from reinfection.
So many of us will be keeping an eye on this testing, Doctor. Do we have to wait for the full results of the study to be published, or will data just trickle out?
Yeah, so thanks for that question. The current plan is that in this initial phase where we're focused in 6 cities, and this does include New York City, Boston, Seattle, the Bay Area, LA, this first phase, the plan is to complete the testing of the first 3 months worth of 1,000 samples per site per month, and pull that data into a publication that would likely be published in the June timeframe. After that, as the study expands to the 25 regions, the CDC is planning on establishing a website-based reporting structure so that essentially the results from samples collected, let's say in July of 2020, the testing will be completed in August, the analysis conducted, and hopefully in the September timeframe, all the results from all 25 regions will be updated, and they'll be updated every month as new data is accumulated.
I love that transparency. I'm sure a lot of people will keep an eye on that site, Doctor. I want to ask about the CDC. It has a new guidance that warns that as many as half of the antibody test could give false positives. Does that include the kind of testing that you guys are doing with donated blood, or are they talking about just the tests given to patients who typically request them?
Yeah, I think a big distinction is between these point of care lateral flow assays, similar to a pregnancy test that you had a photo of on the TV a moment ago. Those tests, many of which were being imported from China and elsewhere, were not very accurate. And that problem with false positive results was attributable to the design and poor performance and lack of FDA review of the results for those assays. In contrast, we're going to be applying very high quality, high throughput laboratory based antibody tests. And these are manufactured and have FDA approval for use in large laboratories and are available now for patients to be tested, but they need to give a blood sample, have it sent to a laboratory, and get those results back. In addition, in our study, we're going to perform confirmatory testing. So we're not only screening the samples with very accurate tests that have very few false positives, well less than 1 or 2 per thousand, but the reactives that we do pick up will be further tested to absolutely confirm that they represent true antibodies to this virus.
Looking forward to the results, Doctor. Thank you so much for being on. Dr. Michael Busch, Director of Vitalant Research Institute, joining us live from San Diego.